This discussion is about the anxiolytics, or otherwise known as the anti-anxiety and also classified as a binary tranquilizer. This drug includes the following: the benzodiazepine, the barbiturates, or the non-benzo and the non-barbiturates. Now, when I think of anxiolytics, I can't help but this is the way how I perceive it. Anxiolytics can bring you the following feeling: the feeling of calmness, being relaxed, having a good sleep and sedation, where all your vitals seems to be low and slow. The indication or situation and circumstances where anxiolytics are being advised. The following are the cases where anxiolytics is sought to be the treatment. Of all the listed below, the following are the most vitals. Anxiety that you are seeing at the right upper portion of the slide, where a woman is having severe to a panic type of anxiety. Anxiolytics will do the trick. And in most people who are suffering from insomnia or the inability to sleep at night. And together, the most important application of anxiolytics would be in situation called convulsion. At this point, we will be talking about the mechanism of action of the anxiolytics. The said phenomenon is happening in a brain structure, what we call the limbic system, which is located deep in the subcortical layer of the brain. The particular structure involved is what we call the amygdala. This is a paired almond structure at the end of the hippocampus. Amygdala is responsible for the roller coaster of emotions, and it processes it. Neurotransmitters are involved in the process, and one of the neurotransmitters that's basically involved is the GABA, or the gamma aminobutyric acid. GABA is, based on our previous study, is a major inhibitory neurotransmitter. And as what we have learned, GABA is said to be the neurotransmitter of calmness. Contrary to that, in a stressful situation, GABA is so decreased in volume whenever there's a stressful situation. And the counterpart of GABA is the glutamate, which is said to be known as the major excitatory neurotransmitter. And glutamate, based on our previous video and our previous study, is what we have identified as a neurotransmitter of memory. Now, in a very stressful situation such as this, say a loss of a job, a divorce, a separation between mother and daughter, in every sorrowful situation, it always leads to anxiety, severe or panic type. It results to fear and panic. In that point and in that situation, major excitatory neurons are hyper-excited. They are hyper-stimulated, causing the chaos in the brain known as the anxiety, the fear, the panic. In that situation, the GABA is like a brake in a car. The GABA will be the neurotransmitter that will calm down, that will slow down the situation. And in this illustration, The GABA will attach to the G-GABA protein. Unfortunately, the GABA at this point is at its low volume. Now, as to the question of what then is the action of anxiolytics, how will the drug anxiolytics will aid the GABA in calming the hyper-stimulated, hyper-excited brain neurons? The benzodiazepine, one of the classification of anxiolytic, will decrease the symptoms of anxiety by increasing the action of the brain chemical, the GABA. As you may see here, the GABA tends to attach to a G protein. And this G protein will now open up the channel. And the action of the anxiolytic is to mimic or help or act like a GABA, if that is a benzodiazepine type. And you see, there are now passage of this important neurotransmitter that is essential to relieve you from anxiety, from stress, from depression. Another action of anxiolytics, considered as in the name of buspirone, is that it will stimulate the serotonin and some other dopamine receptors, and these are the happy hormones. It will alter the chemical messages that are being sent during a very stressful situation. It will turn it into a relaxed, a calm brain condition. And this is the action, and this is what is happening to your brain, to our brain, whenever we are suffering from under stress, under fear, and under anxiety. The following are the list of medication under the benzodiazepine and the non-benzodiazepine. At the left are their generic and trade name. In the middle are dosage and half-life and their onset. By the looks of it, it's not that easy to appeal that into your memory. But let's try to take this differently. When we talk of benzodiazepine, we may notice the AZE in the middle, bromazepam, chlordiazepoxide, premazepam, lorazepam. This can either be distinguished by the AZE in the middle or the suffix at the end by the PAM. By looking closely as to what are the important benzodiazepine, this will become a memory trick. From the word benzodiazepine, it can be aided with the word Benz, as it is a luxury car, the Mercedes-Benz. And there are two riders, a lady riders named Pam and Lam. If that is a Pam, then that we call it as temazepam and clonazepam. These are the most commonly asked benzodiazepine in the board. Together with the Lam, the alprazolam, and the midazolam. These are the most common, and this will serve as a memory trick to memorize the benzodiazepine. Let's try to know more about the benzodiazepine with the symbol of gabapentin. They are classified as short, medium, and long according to the time that they will act. The shortest would be 1 to 12 hours. That's half the day. And the medium is 12 to 40 hours. That's more than a day. And the long is a very long time, 40 hours to 250 hours. And if it is a short-acting benzodiazepine, this will fit the panic, the status epilepticus condition. If it is a medium, the anxiety, insomnia, and panic disorder are the kind of the disorder to be treated. And if it is chronic panic disorder for a very long time and alcohol withdrawal, then a long-acting benzodiazepine is needed. And here's some more. You have the duration of the benzodiazepine. And the next thing that you have to remember are what are those drugs under the short acting, under the medium acting, and the long acting. Now, this is quite many to remember, quite a number to remember. What if we make it easier by looking into Tom? If you still remember Tom in the Tom and Jerry, then he will help us here. Tom, as if we look at this, Tom is from letter T, letter O, and letter M. That's Tom. Cat, C-A-A-N-T. That's Tom the cat is DC. And that's what he is. Triazolam, oxazepam, midazolam. That's the name of Tom. As a cat, he is a clonazepam, alprazolam, and lorazepam atibam, and temazepam. If he becomes DC, then that is diazepam and chlordiazepoxide. And here's some more nurses about the nursing consideration, which I can say must know. You should know this when giving benzodiazepine. Number one, benzodiazepine generally are fast acting. Benzodiazepine can cause addiction. And benzodiazepine is inadvisable for a long-term duration. And here's some more. When you're giving benzodiazepine to your client, take note that it can cause sedation, it can put the client into sleepiness, and you have to check for the airway, breathing, and circulation as it suppresses this together with the safety issues. Benzodiazepine can cause low and slow body functioning. It can cause bradycardia, bradypnea, low and slow consciousness can happen. And here's some more. Finally, when you are taking your examination, do not forget that benzodiazepine must be given and taken at bedtime because this can cause sedation and sleepiness. Tell the patient not to skip any doses. These are the two most important questions all the time. The client should stop drinking alcohol while on benzodiazepine, and clients are not instructed to drive home and use some dangerous machines. And if worse happens in the overdose of benzodiazepine, take note, the benzo antidote, clomazepine, and for opioids antidote, the naloxone brand name, Narcan. This is a must-know for nurses when giving benzodiazepine. Let's talk about barbiturates. This kind of medication is easy to remember. These are the drugs that ends in barbital, such as that of the Barbies when you need the memory tricks to remember. These Barbies or barbital can stay in the body for a long time, such as 3 to 5 days. That's a good news. However, there's also a problem of letting it go. It stays in the body for a longer time, and possibility is that there can be physical and psychological addiction, severe withdrawal, and even can cause coma in toxic dose. That's why barbiturates has been replaced by benzodiazepine due to several negative effects. These barbiturates can be used as an anxiolytics, hypnotics, anticonvulsant, and even anti-epileptic. Here's some more. Nursing consideration must include, one, it can cause hypotension. That's why nurses must remember when giving phenobarbital, you have to monitor for blood pressure. And for respiration, it can cause a CNS depression, thereby decreasing respiratory condition. And it can even result to coma up to death. And here's a lot common things that is nice to know with respect to barbiturates. This barbiturates is a CNS depressant. That means it also acts like alcohol in your head. And if anxiolytics is just but a minor tranquilizer, this barbiturates is a major tranquilizer. And if that is a major CNS depressant, then there must be a legal prescription when you're taking barbiturates. And the rest are just good things to know about barbiturates. Let's talk about the last classification of anxiolytics, which is the non-benzodiazepine. Now, this kind of drug is so called as the buspirone. As a memory aid and a memory trick, remember always the bus that you should never miss. And buspirone, the disadvantage only of this bus is that when you take inside, it's gonna take a long time or slow time to kick in. That is, this drug will take effects only after 2 to 4 weeks. That's almost a month. And that's why the patient will feel sometimes that it has no effect and may discontinue to do that. But the good thing about buspirone is that there is no withdrawal symptoms. There is no sedation. And that is a non-benzodiazepine called the buspirone.